Let's get started first of all with total hip arthroplasty and their indications. Now, the recognized indications for this procedure is really the end stage of osteoarthritis of the hip, but this comes about when appropriate conservative care has failed to relieve pain and disability. Other indications are osteonecrosis, displaced fractures of the femoral neck, metastatic tumors of the hip, inflammatory arthritis, and also often after septic arthritis of the hip itself. There are multiple factors that influence the outcome of following total hip arthroplasty, but most of these are actually patient-related. Let's have a look at some of these. First of all, age. There seems to be no significant difference in outcome for those that have a total hip arthroplasty under the age of 65 versus those over the age of 75. There is, however, a difference is determined by gender, with females reporting poorer functional outcomes compared to males. Also, obesity. Higher functional outcomes are seen with individuals with higher BMI. Now, this might be surprising, but if you stop and think of it, those with higher BMI may not have been able to walk, not be able to be active prior to their surgical procedure, and as such, now, following their surgical procedure, are now able to walk and be more functionally active. Ethnicity may also influence perceived outcome, with Asian individuals reporting a higher functional expectations. And this more likely not is cultural, as many of these cultures tend to squat or kneel while eating their dinners. Psychological status. We know that depression and anxiety causes a greater dissatisfaction despite having equal functional status post-total hip. And other comorbidities such as fibromyalgia and multiple joint arthritis leading to lower levels of satisfaction.